The state government has ordered an independent investigation after almost 50,000 x-rays taken at 2 hospitals on the Gold Coast weren't reviewed by a radiologist. Hospital authorities say at least 2 patients have suffered adverse outcomes as a result.
When a patient has an X-ray, it should be looked at by a radiologist. But it's been revealed Robina and Gold Coast University hospitals haven't been doing that.
An expert looks at every plain film X-ray. The safety net, an additional step, which very, very occasionally throws up something that the first doctor missed, is a step that hasn't been happening in all of our cases.
Since September last year, 48,000 plain film X-rays have not been reviewed by a specialist radiologist. Of those, 22,000 have now been prioritised for review, while the remaining 26,000 deemed lower risk will be dealt with soon after. So far, 2 patients are confirmed to have suffered adverse outcomes as a result of what the government's called a systemic failure.
And we've had a full and open discussion with those patients. We're providing support and will continue to provide support to them.
The Gold Coast Hospital and Health Board says it struggled for some time to adhere to best practice in X-ray reporting.
There's been no attempt to hide any of this. All these figures are reported on a regular basis.
The Queensland Health Minister says it's an isolated problem, but others fear it's more widespread.
I think it's certainly possible that it's happening in other hospitals in Queensland.
Dr Slater says it's crucial a specialist radiologist reviews all X-rays to ensure secondary diagnoses are not missed.
A typical example might be a little tiny lung cancer lurking on the edge of a chest X-ray film.
$1.4 million will be spent on the enormous backlog, and the government has announced an independent investigation. Courtney Wilson, ABC News.